Alright, Assalamu alaikum wa rahmatullahi wa barakatuhu. Ahlan wa sahlan. Welcome everybody to the next episode of Enriching Talks with me, Hafsa. Today is a beautiful day in April, and this is episode number 15 of our Enriching Talk. And April is a very special month, and our talk will be surrounding everything about this month. So, starting with introducing myself because we have lots of new people in. So, my name is Hafsa Qureshi. I am a certified childbirth educator, advanced doula, postpartum doula, specializing in VBAC, vaginal births after C-sections, multiple C-sections. I'm also a certified breastfeeding specialist, lactation educator and trainer, a newborn care specialist, and a lot more that you can see on the screen. I have been in this profession for the last 14 years now, alhamdulillah. And like I said, April is special because April is the C-section awareness month, and I am a C-section mother myself. My first was a C-section 17, this year it's going to be 17 years ago, and that is what brought me into this field. And then I had 2 VBAC births, alhamdulillah. And yep, the rest is history. Once I navigated into this field, I realized that how much this awareness and education and support is needed for all the moms and moms to be. And that is what I've been doing. I've helped over 1,500 moms last I counted, and probably much more now, alhamdulillah, all over the world because my work is mostly online. I teach childbirth education classes online and different workshops. And I've started these series of enriching talks. So when we've reached episode 15, I try to do the monthly, but yeah, I know there've been some months gaps if I'm traveling or if it's Ramadan and stuff like that. So yeah, we try to bring in special topics and speakers in order to do specific awareness methods to be able to reach and get more and more mamas more informed. So that is the vision and mission behind this, because this is not your usual talk show. I'm sitting here at home and I have a speaker from somewhere else in the world, and that the whole purpose of doing these little talks is to provide awareness for free, first of all, and to inspire you all, provide stories, methods, tips, motivations, anything you might have in your mind. We always have a question and answer time at the end as well. So stick around all the way till the end. We've got amazing tips and things coming up today. So without further ado, I am going to just pop on and introduce our speaker for today. So like I said, April is C-section awareness month. And since I am in the birth field as a birth worker and as a lactation educator, I have helped a lot of moms, not just with their VBACs, but with empowering C-sections, and then also with traumatic C-sections, helping them debrief and walk through those as well. So we need to acknowledge and we need to understand that C-section is never the easy way out. We need to understand and hold space. Like I said, I can relate with each one of you, right? I have been through one myself. And had that C-section not happened, I would not be sitting here today and doing this, not be in this field even. So I'm thankful for my C-section now, although it was a very traumatic experience for me nevertheless. So today we have Virginia Coach. I have been following her for a while now, and I'm just loving the work that she's doing, mashallah. And she's originally from Spain with over 10 years of experience in fitness and women health. I feel because I'm observing in all these years that I've worked with, I feel we work and we focus on pregnancy, birth. Very little focus is given on the postpartum part. And regardless of the birth outcome, whether it's a C-section, whether it's a natural birth, I really feel we need to spread more awareness and put more insights towards what happens after birth, because that really is very important, that rest, recovery, and getting back onto your feet. And this is why we have this amazing speaker with us today. And she has been working with women in the motherhood journey itself. And her career in Kuwait began as a personal trainer and a strength and conditioning coach. But then she found her passion. I think this is where Virginia and I are very similar, because once I found my passion, I'm not looking back. So she found her passion in supporting women through pregnancy and postpartum, and has helped over 700 moms feel strong and safe through her signature training method designed to support pregnancy and restore strength and confidence after birth as well. She has a master's in women's health from Spain, with advanced high performance pregnancy and postpartum education, and a certification as a pregnancy and postpartum corrective um, exercise specialist as well. She also helps athlete and active women continue training safely throughout the extraordinary chapter. And so this is not just about training, it's more about helping every woman feel powerful, supported, and deeply connected. So this is her little introduction. I am going to now give the mic to her. She's here. So can you briefly, I've given an introduction, but can you add more to it? Your journey into women's health and what led you to specialize, especially in pregnancy and postpartum, Virginia?
So first of all, Hafsa, thank you so much for your introduction, and first of all for invite me here in your space to spread awareness about Csection and another topics that you've been doing since a long time, and you are doing great. And I'm so happy to be in the file of the women's health, because it's really important. It's like not many people speak about, but as women, and in our file that is pregnancy and postpartum, we need to give so much awareness, because it's so much what's happening during pregnancy, during postpartum, vaginal birth, for example, C-section birth is so much, and the women go through so much, and we need to express this awareness, because it's very important. It's very important in the face of the woman how to recover mentally and physically. So thank you so much, first of all, to you to be doing all your work that you've been doing through all these years, basically. I'm starting 10 years in the fitness industry, but after I find, as you said, like about my passion, that at some point of pregnancy and postpartum and all the recovery through all the journey, because it's only about to be training, it's about lifting weights, it's about how you look, it's about how's inside of yourself, how's function, because the function is the more important, because this is as better function, as better you're gonna be dealing with in the rest of your life on point of your woman's health patterns, because it's so much of how you look, and the people, the women, sadly, this is the result, but sadly only you care about how you're physically. No, it's so much more in pregnancy and postpartum. Now in this month, what we are in the Csection awareness month, we need to be speaking about how's inside. And this is my passion happens because I saw my clients. I came to Kuwait. I started to be training as a personal trainer and strength conditional coach, and I saw them training, getting stronger, and then they get pregnant. But not only how to be training them during the pregnancy, it's what's happening inside of them. It's many changes, physiological, hormonal, structural. So we need to see more and more to be dealing in this point. And then the jumping of the recovery part, that is more change, and the hormone play a huge role, and mentally is how they look, and nobody say to them like what is going to happen and what is the next step to be dealing during the postpartum stage, how you need to train, how you need to recover, how to deal with yourself plus your newborn, it's many phases that it's about to give birth and that's it. You need to deal with your life without take care of yourself. No, we need to be giving this awareness on how to deal through all the stage and to have a properly path. You know, this is my passion. I discovered in this way, and I try to put my point of view, basically.
No, it's very, very important. Like you said, it's not just you give birth to khalas, right? It is much more than that. And subhanallah, I think very little is talked about this because many women don't realize that, like many don't even know that they should be doing something, sah? And that part is what we need to change, because it not just impacts her, it impacts her ability to recover on the longer run. It impacts future pregnancies, impacts her ability to take care of her baby. So many factors are there. So now jumping on to the topic of C-section recovery. So starting with understanding the C-section recovery, how would you classify that? What makes this recovery different compared to if it was like a vaginal birth or a natural birth? Not just physically, but mentally as well. What would you say? What would you have to say about that?
Totally. First of all, we need to make a big difference between what is C-section recovery, what is vaginal birth recovery, mentally and physically. We treat, then it's a combination of everything. But in the end, we cannot be forgetting that C-section birth recovery is a surgery. It's a surgery and it is happening, and that the women need to understand that plan happens. You need to understand that when C-section is happening, they cut 7 layers, and as a surgery, it's a skin, it's a layer of fat, then the fascia, then the abs that they separate, the another one is the peritoneum, then the uterus, and then they reach the baby. So 7 layers, then the process happens there, they take the baby, and then the stitches, and we cannot forget that it's a process that is cutting. So this recovery needs to be a part of healing and respect that birth, when it's vaginal birth, if the baby is going to be into the position with like going through the process of the birth, but C-section is a surgery. So it's a time to heal. Everyone is different. We totally understand. Every woman has different background. But the first 2 weeks or the first 4 weeks is time to heal, or even until the week 6. Everyone is different. There are different patterns. We need to see how's the evolution, how's the pregnancy, but it's a time of healing. That is the first 2 weeks is very important to see how's going to be the scar, how's going to be the healing of the scar, then how it's reacting the pelvic floor, and then when you get the clearance from the doctor, is the moment we can be starting to be doing more process. But the first 6 weeks is the healing part, and to see how's going to be the recovery. This is the more important. Natural birth is a process and it's totally grateful, but also has a healing part. But this is not a C-section, not a surgery. So this is, we need to be clear in this point, okay? And mentally, on point of mentally, physically, when they get up, we need to respect them that in the end, this C-section sometimes for them is a big trauma because they were having expectation that it's going to be natural birth, that the recovery is going to be more smoother. There are girls with pain. There are girls like suffering because they were the high expectation to be the faster recovery. And it's more important to let them understand that this is not a race. This is a time to heal. With the C-section, that is a surgery. Same when, for example, someone do a surgery in their ankle, and the next day they're not going to be running. They're going to have a path to recovery. This is the same. So let them understand and support them on this stage that is, we need to heal and slowly to build up on point of the core, pelvic floor, lower back pain, because it's core function, not to drop themselves and halas, nothing happened, you know?
Very true. Especially, I think that what you just gave a very good example that if anyone would have a surgery, we can't expect them to just bounce back. And a C-section, it's not just you are also taking care of a newborn and you've been cut through 7 layers. So giving ourselves that slack. And I remember myself when I had my C-section, for at least a good 2 to 3 weeks, I was really dependent on the support and help I needed, right? Simple, small tasks. All of that was hard, right? So I think physically, yes, definitely giving yourself the time, but mentally as well, accepting that, okay, it is okay to take time as well. Don't be hard on yourself as mothers. You've been through a big, major surgery, no doubt is that. So what are common mistakes would you think that many women make after a C-section?
The more common mistakes, the number one is like a think that nothing happens. No, you have a surgery. You have a point, like you need to give this time to heal. Number two, on point of training, that you understand that nothing happens and you want to start to be training lifting heavy or doing what you were doing previous pregnancy without care, without realize like this is a process that you need to be healing. You cannot be starting to jump or running or lift heavy. No. It's amazing if you want to have a background that about the sports, athletes, and it's very good. But you cannot forget that pregnancy is a process of 9 months that many changes happens. So you need to give this time what we're speaking about healing. Then another point, if in case you have a pain, you cannot ignore this pain. You need to do a checkup, follow up with your doctor. Even like, for example, week 6 C-section, if the doctor in that moment give you a clearance, maybe you need to do a checkup with the physiotherapist to check how's the core function, the pelvic floor, if it's weak or you have a dysfunction, could be a prolapsum. It's very important. Also, another mistake could be the way how you're gonna get up from the bed. Like if you are laying down or in the couch, you are laying down, you're gonna be crunching because you're gonna be putting so much pressure in the pelvic floor, so much pressure and producing a dysfunction. So this crunch or this twist in the first weeks, we need to stand up from the side. So it's very important. And another point, neglecting the scar as a treatment. No, we need to take care about this scar. They just cut it, what we were mentioned before. We need to give a treatment, like we need to let them heal. And it's very important, don't forget about the breathing work, because this is what is gonna help you for the engagement, rebuild the deep core muscles, these muscles that is been struggling, okay, or putting so much pressure, and now they cut it, and they rebuild like we don't know what is happening there. So we need this strength. I'm not saying to you to do jumping or crunching. No, we need to do a properly rehab, a properly rebuild. To don't forget these steps that should be there.
Yeah, you're right. Very, very important. And I love that you mentioned that fact. And those that have taken my birth classes, I always say that at your 6 weeks, like after 6 weeks after birth, just like you see your doctor, I emphasize it's double important that you see a physical therapist, right?
Exactly.
That is very important. Someone specializing in diastasis, abdominal muscles, the pelvic floor. It is very, very important. Like, I think even more important than seeing your care provider, in my opinion, because it made a big difference for me until I didn't know I was suffering. So I really want mom. I want them to understand that. So just let's start from the very beginning. So the first 6 weeks after a C-section. All right. So we have some moms here who probably just had a C-section or are going in for a C-section. So the first 6 weeks, what should be the focus on, right? And what would be some safe movements in the early 6 weeks right after the surgery?
Okay, the first 6 weeks, you need to put on mind that you cannot be on a rush. This is one point. You need to accept that it's a process of heal. No es a postpartum, no es a full marathon to reach no es a sprint, no es a full marathon that you need to reach the first one. It's a process of healing. This process of healing could be faster or slower. So the first point, like at the first 2 weeks, especially, like they just cut it and this, it's time to rest and time to heal the scar. Rest, I'm not saying to you to be laying down every day. No, rest is to be taking care about yourself, what your body is reacting, how reacting to observe yourself. Even like you have a newborn, even you don't have a newborn or you have more kids. But one of the things I say to everyone, like don't lose yourself. It's like put attention about yourself to recover in this stage, and resting is time to healing. Rest could be 10 minutes or could be like a gentle mobility in this stage, like a 5 minutes another day if you are feeling like to give more range of motion. But this time, this very important in this stage is the posture awareness. Like you cannot be dropping yourself. Like your posture is gonna keep your, for example, the deep core muscles activate. The deep core muscles is the muscles that they were supporting the weight of your baby, the size of the uterus, the size of what is happening inside. So this posture, when you give birth, you cannot forget about like that, to keep yourself like that. No, you need to shoulders to the back straight, for example. If you want to be breastfeeding as well, it's another topic and another point that is going to be keeping yourself in a good position. You cannot drop. So posture awareness in that moment is very, very important in that point. Then pain management. If you feel pain during this stage, no some point to forget about. No, some point like okay, what I have the pain, what is the pain, what I can do. Like no some point of be training. No, it's about maybe mobility, gentle mobility exercises to decrease, for example, some stiffness from the epidural. Many things can happen in this stage after birth and after C-section. So we need to listen our body. Another point that is very important, and many moms forgot about this point: hydration and nutrition. Nutrition, I'm not saying, when I'm speaking in all the stage of life of the woman, I'm not telling you to do a diet. I never want to be saying that. I want to tell you quality of the food, quality of the lifestyle, because this is going to help you to put all the nutrients that in this stage of the C-section to bounce back, to heal, to help to the body to reconnect. So you are putting a very good nutrients is what is going to make your body to recover properly. If you want to eat, for example, junk food or chocolates, these sugars, we don't need it. We need a nutrients that help the healings and bounce back on point the hormones, structural, also the healing for the scar, because it's many layers that they will be cutting and need to be healing properly way. So the hydration as well, no 1 liter, like 2 liters and a half, 3 liters, all this combination of food is gonna help you. Even if you are breastfeeding, because if you are breastfeeding with C-section, when you're breastfeeding, the baby takes all the nutrients, all the vitamins, the iron. So this point needs to be very, very well aware in that point. Not to be perfect, but be aware what you eat, okay? And then reconnect the deep core muscles. Like it's very important in this stage, gentle movements, gentle breathing, okay? I'm not telling to do a fixed program in these 6 weeks. No, it's time to see how's the evolution of yourself. So this deep core, this deep breathing is gonna help you to reconnect the deep core muscles. So slowly to start to build up. If in this is week you feel comfortable, nothing to be rushed. But also it's very important because it's gonna help you to drop the nervous system if you feel so anxious or so nervous, because it's only physically, it's mentally, it's many changes what's happening. So the deep breathing is make your nervous system to drop, to make you more calm. So even if for example, the newborn is crying, this breathing is gonna help you to feel more comfortable in this stage.
Very important, yes. I'm glad you mentioned the deep breathing part, because I think breathing is one big mechanism we have when it comes to pain management. And I remember when I held my breath, it was harder compared to when I was doing the deep breathing as I was moving, and focusing my attention on the breathing part just really helped me with the movements, like you said, while you're nursing. And now that you mentioned the breastfeeding part, and I love that you mentioned posture, and all of a sudden I sat up straight myself. But when it comes to posture, always remember that you bring the baby to you, never come down to the baby, right? So this is for every woman who's breastfeeding, that never come forward towards the baby, always pick the baby and bring the baby to you. And that makes a big, huge difference, not just towards the latching, but towards the posture and towards how you feel as well on the longer run. All right. Okay. So after the first 6 weeks, so like you said, not to do these common mistakes, focusing on the breathing and giving yourself that time mentally. How about regaining that strength? So this mother, she's done the initial recovery now. She's a few more weeks or perhaps few months postpartum. What can she do to help regain her strength safely? Like, when is it safe, for example, to start exercising after a C-section?
This is a point, like always I said, every woman is different. Every woman's like a with C-section in this case is gonna be different in the how it's gonna be the recovery. But 6 weeks of healing, and then the process to start. The more important is to have the clearance from the doctor and the checkup with the physiotherapist to see how's the core function, the diastasis with dysfunction or no, pelvic floor, how reacting the pelvic floor as this area that is our most important woman's part, okay? So on that point, we need to start with the rebuild the deep core muscles with the breath core engagement, okay, in different positions, in different with different loading, like we start like without load, like how is the pattern of breathe, how's the pattern of the deep core muscle, how you breathe, how's the function, diastasis, no diastasis, but rebuild the deep core muscles. In that point, we rebuild with the diaphragmatic breathing to rebuild the strength in that area and with the pelvic floor. And in that is helping also to reduce the pressure on the scar. What we mentioned, 7 layers scattering. So when you rebuild the deep core muscles, the core is rebuilding all this area that it was affecting, like these 7 cut layers, like stitches, we decrease the pressure and also so much mobility exercises to increase the range of motion, hips, thoracic spine, upper back, all this area. And depends how is the background, depends how the woman's feeling, depends. We want to be loading and including a bit of strength training, lower, upper, but we need to see how it's going to be. And what I say always, depends on the background, depends if they train or not train during the pregnancy, and how's going, also depends how is the sleeping of the woman. We cannot put many load if she doesn't have so much sleep because the lifestyle with the baby and this. So we need to design a properly program, but loading depends of many factors. So we need to see, but this is the more important, breathing exercises to rebuild the deep core muscles and slowly loading with a strength training, depends of the background or the requirements in the woman, basically.
Right, I get you. Okay, so what are some of the safe movements that we can do or should we avoid? Say in the first 3 months within
Sorry,
the
Hafsa?
so safe movements. What are some of the safe movements that a mother who's had a C-section she could do after, like if she's 3 months postpartum? And I'm sure there are moms here right now who are way past, like maybe 6 months after a C-section. So getting, I think, assessment, like you said, is important because every person would be different. But within the first 3 months post surgery, what would be some safe movements or safe exercises perhaps that she could start on? I mean, of course, it's best that she works with a personal trainer like you, but something that she should keep in mind in order to start off.
Okay, the first one, we need to take care, okay, standing up from the bed, from the side. We cannot be doing crunch. Crunch is not a safe exercise. If you want to rebuild the deep core muscles, you cannot be doing like these crunches or this twisting exercise. This is number one. To rebuild like all diaphragmatic breathing, you want to be doing like the inhaling is going to be from the nose. We expand the rib cage, and in the breathe out, we want to be connecting from the pelvic floor. And an example always I say to everyone, imagine, for example, you have the belly after the C-section, or still, imagine you have a very tight dress on you. Like imagine in the exhale, you want to be putting the belly inside, but you need to be aware like you are doing from down, from the pelvic floor. Reconnect this core is happening like with the diaphragmatic breathing. Then also like with this diaphragmatic breathing, like we can use a softball, for example, bridge, laying down on your back on the floor, and you want to be putting your hips up with the first of all, diaphragmatic breathing, what I was mentioned, and the softball between the knees. Lift the hips up, and again, starting from the main point. Or bird dog exercise is very safe because you are going to be in this position. You want to extend opposite arm, opposite leg with the diaphragmatic breathing. Make sure this belly is going inside with the pelvic floor in the exhalation. What you need to be aware, in the exhale, the belly doesn't go out. We don't want to put pressure. The baby is already out. We don't need to push. We need to pull. We need to close these deep core muscles. Okay. Glute bridge, bird dog, all of that is going to be helping so much in the beginning. And avoid totally all the crunches or planks or pressure exercises that is going to be putting pressure in the pelvic floor and abdomen. We don't want to put the belly out. No, we need to reconnect and bring it inside at what it was previous pregnancy.
All right. And how can a mother tell if she's overdoing it or if she's pushing herself too hard? right? What would be the signs? How would she know?
Like, for example, lifting weights, like you cannot be in a rush. You cannot be in a rush. For example, having pain or bleeding or this kind of intense exercise, you're gonna feel discomfortable. You cannot be in a rush, because in a rush is gonna give you this kind of pain, and you can produce pain in the lower back, the pelvic floor, or in the abdominal, or sometimes even you wanna feel from their stomach, if you wanna have dysfunction, if this is the core and this is the separation, sometimes you see like something going out from the stomach. And previous pregnancy doesn't be like that. This is protraction, this is doming, this is like a pressure is coming from inside of the deep core muscles, because the deep core muscle is the function is like a corset, it's closing. If this core is not strong, it's gonna be separate. So this pressure is coming from inside. Is this protraction? No, we need to close, we need to rebuild. So this kind of pressure of exercise that is gonna give this kind of reactions. This is like we need to stop to see from where it's coming, or this bleeding or this kind of pain, and don't forget about it, because as soon as possible you wanna rebuild, as soon as possible you wanna heal this part. Later on it, you don't want to have any issue. And now I'm not speaking to train more or train less. No, on point of women's health. That is more important, because the first stage of the postpartum is the time to rebuild and fix everything. So later on it, diastasis or prolapse or ordino is going to be there. Or later on it, if in case you want to have another pregnancy, or when you want to be 50, 60s, to don't have any urine incontinence, that is a dysfunction, or to have a prolapse. No, we need to rebuild. And the rebuild is coming diaphragmatic breathing exercises to avoid this kind of pain, or avoid this kind of bleedings that is not safe. We need to be safe and doing the things properly.
Yeah. And then now that you mentioned, I do remember after I had my C-section, that just simply sometimes getting out of bed, I would get that dooming, right? Like that you said, because there was big diastasis, like that separation was there. And I didn't know until I did see a physical therapist, and they said that you have more than 3 fingers, right? They do an assessment to check. And then I was like, okay, I haven't been very consistent. And I didn't know all of this until much later. And I don't want moms to suffer from it, because yes, a lot of your muscles and your layers are cut. And this is why it's very, very important that before even you start any actual like strength training or any actual very active exercise, please get checked for what just Virginia said as well. Get checked if there is a muscle separation and if that core has healed. Because if you don't, you might end up messing it up, and things like hernia and I don't know what, prolapse, like the uterus coming down or the bladder coming down, all of these issues start happening. And then that recovery is another long journey afterwards as well, subhanAllah. Yeah, so this is very, very important that please, please, please get yourself assessed properly by a women's health physical therapist to check for all of these separations. And then go do the exercises like just she was saying, the ones that are safe, which are not adding too much pressure onto your core. Because otherwise, I think another very common mistake we have, at least in the culture that I've seen, is they love wearing belts and corsets after birth to squeeze the stomach. What do you have to say about that?
I'm dealing. I'm trying to remove this mindset. Is like only there are one point, and this is something is coming from the doctors or the physiotherapist. Okay, to wear this belt is only if they say these people, but you need to have go to them, check if there are prolapse or the diastasis is even 6 centimeters previous. Long time ago, I have one woman with 6 centimeters from top down. Incredible.
Wow.
We fix it. 2 years take us. So what I want to say, like a fixed diastasis could be with exercise as well, but put on mind that it's a process like a being rehab. And in this case, in the beginning, they told to her to put this belt. In that point, totally. And I'm not anyone here to say not or yes. This is the person needs to say who wanna be putting. Because in this point, this diastasis, what we mentioned before, the deep core muscles do as a corset, is holding. So if this is 6 centimeters, like all the core is open, the viscerals is gonna be like a falling outside, like it's putting pressure outside. So what is gonna be doing the corset? To be holding that point. This is the only point. If the physio doesn't mention to you, or the doctor has said, because it's a big dysfunction, no, what we need to do is rebuild the deep core muscles, because your deep core muscles is your corset, is your functional corset. So we need to rebuild the deep core muscles to closing it, to put this pressure inside, because this is very important. If you have diastasis, no problem. We need to rebuild the deep core muscles, because this is what is going to make yourself strong, like to close, like to have the control. Because with the diastasis or no diastasis, or even if you don't have diastasis and the core function is off, you're not available to stand up, to have the control. You feel unstable, because also your hips is going to be opening. So that's why it's very important to close. And please don't wear this corset, because, or this belt, because what it's going to make is the opposite. Imagine if someone has twist their ankle, they put this cast. When they remove this cast, what happened? Always these muscles, they are very weak. In our core, it's going to happen the same. If you put this kind of grabbing or this, you are doing the worst. Only with the physiotherapist telling you, like, you need to put it because it's a big dysfunction and we need to work, and this is going to give you the support. Amazing. Other than that, no, please, no.
Yes,
very important.
Because I get this question all the time. Can I use a postpartum belt? I'm like, no, you can't, because that's
You're killing
not
yourself.
Yeah, like you said, it's going to spoil the muscle, right? And that gets it's a longer recovery then, compared to if you start working on your core earlier on, right? Thank you. I think that was a very important point. Just popped into my head, and I'm like, I need to mention this, and you added like the golden nuggets to it. So thank you so much there. All right. So what about the scar? Like a woman, she's gone through a C-section, the scar is healed. It's been 6 weeks. What can she do for the scar? Like initial care as well, like before that and afterwards, once it's healed. What's your take on scar massage, and how would you work with the scar of a previous C-section?
In that point, it's very important. It's something mostly many women is forgetting about it. Okay, they heal, they see everything is fine, but they keep forgetting about the scar. No, we need to be aware about this scar. It still is there. We need to be treating, because this scar, what we mentioned before, they cut 7 layers and then the stitches. And then the scar, sometimes you don't realize, but get numb, or some pain, or some redness, or some bubbles on top. We need to treat with a massage. For example, this is the scar. There are a massage like a circles on top of the scar, one direction, another direction. Then if this is a scar, we separate like that. Then we remove the skin from the scar, because with this kind of massage, what we are doing, like, it's going to increase the blood circulation, more oxygen is coming in this area, and this adherence that is happening, because with the scar and the stitches, they get sometimes the skin, the fascia, the muscle, everything is stuck. No, we need to separate. We need to give this movement. So as more movement, we wanna release any tension happening in the pelvic floor or in the lower back pain. We need to treat very well to avoid any stiffness. That in the beginning could be a stiffness, but if you don't do any treatment, what is going to happen? Maybe after 8 months postpartum, 1 year, 2 years, even 5 years, I had one girl having so much lower back pain. We're checking from where it's coming, what is happening. Lifting, she was properly lifting weights. And this is happening in the end, like I let her to do another checkup with the physio. And the physio said, this scar is the adherence, because previously she never do anything about the scar. This scar needs to be treated, to be healing on point of everything. Also, physios maybe sometimes do some treatment to release. But this massage, number one, and then so much mobility on the pelvic area to release, to avoid any stiffness. Sometimes when the stitching pull more tension from the lower back. So release, to open. It's very important to have full range of motion in the hips area, also in the thoracic, but in the hips area, to avoid anything later on it. But the massage, number one. In the moment they tell you the green light, from the doctor is clear, everything is fine. Massage, or in the week 4, even depends how the scar, you can do it. It is totally fine, and you have to. Even if you see everything is fine, no numbness, because if no, you can have issues for the lower back pain, pelvic floor, or internal pain. Like they need to check more with the sonar. So to avoid, we need to avoid or prevent.
Yeah, I remember you mentioned the sonar. I remember when I went for my check for diastasis, she actually used the sonar to see not just the diastasis, she checked the scar as well. And what you're talking about the sticking, it's called adhesions. So I feel like if those adhesions are not addressed, it can have like lifelong complications. Even
Yeah.
like I've had VBACs, and because I did not deal with my adhesions after my first C-section, I'm still like facing issues 17 years later. Imagine,
Yeah,
right?
totally.
I'm a victim of that, and because I didn't, so I don't want you guys to make that mistake. So working, and in fact, working with the adhesions helps your chance for natural births next time as well. So yeah, please, like she said as well, scar massage and working through those adhesions is very, very important, and it should be part of your post C-section rehab, because otherwise, because it starts all sticking. I attended a C-section recently, and I was very it was a repeat C-section, so that mother was having after like 3 or 4, and the surgery was taking so long because there were so many adhesions that they had to really, like, literally, it became a very risky surgery rather, because they had to cut through so many layers. So please, like, for even if you're not planning for a VBAC, just the fact that you've had a C-section, please take care of your scar and do that scar massage. It helps take away the numbness. I mean, for me, the most annoying part was I couldn't feel myself there, right? Like when you're touching the scar area, you don't feel anything, and that was annoying. It was like I was disconnected with that part of my body, right? Because the
Exactly.
nerves are cut and everything. And since I did my scar massage like years later when I learned about it, and even then I saw improvement. So you guys who are like more new right after a C-section, you guys have more chance of getting those feelings and sensations back, yeah, anymore basically. So yeah, thank you so much, because scar mobility is something which is very often least talked about, and if it is talked about, many people don't do much about it, and they don't know about it until they're in the next pregnancy even. So it's very, very important. What about like you already mentioned about the core healing? What about in general? So it's a postpartum mother, whether she had a C-section or a natural birth, right? How long can it like it's very individual how long each person is going to take depending on how much time, but there is the wisdom behind planning the next birth if they're planning a C-section, a natural birth next time. So normally I would recommend, as a VBAC professional, I would recommend minimum 18 months, ideally 2 years between the gaps, so you have the time. So like Virginia said, you have that this whole 2 years to work on yourself before you plan your next pregnancy. So in that whole time, I just want to ask you about the fact that the working on the core, how would you feel like, is it something that happens in 1 month or 2 months, or how long can the process take تقريبا, like approximately?
On point of how long, I said everyone is different. Every woman is different, and what I mentioned before also, like it depends the backgrounds, depends pregnancy training, depends how is the core function, depends on many things. What I said, and we divide like a postpartum is the early stage of postpartum, mid stage of postpartum, and late stage of postpartum. What I say, in the early stage of postpartum, you're gonna have amazing results. Usually in the mid postpartum, that could be 6-7 months. In that point, needs to be everything healed. There are girls in 3 months postpartum until 12 weeks postpartum could be healed, totally having a really great results. But there's a time we need to deal with everyone. But and this is also my experience. Like in the month 5-6, usually everyone is 100% healed. The girls that is healed in the 12 weeks postpartum, for example, that this is 3 months, for my point of view, and this is also coming from my experience, who was trying during the pregnancy, that they don't have any complications with the labor time or the C-section time. So we can have 12, 15 weeks postpartum, we can have a very, very good result. 6 months, 5 months, if everything is going fine, is totally fine. We need to continue rebuilding. It's about we did a rehab and we forgot about it. No, we continue working and loading on point on the intensity, on the different kind of exercises to be targeting this area. So the deep core is gonna be engaged. So we don't wanna have any issues, because my function also not only about to fixing that stage, if no, to keep maintaining like the strength and these deep core muscles in case what you mentioned before, after 18 months, so they are strong for that new process that is gonna come for the new pregnancy. So it's a process like we don't wanna be a stick in the same exercises, for example, but we wanna continue strengthening through all the months until get the very good results, and they don't wanna have any issue basically.
Right. Yes, makes sense. And I like the fact that you guys split it up as well. And I think I heard also about that you should not be lifting something heavier than your baby, at least for the first 3 months. And that's very important, because if you start lifting too early and before everything is healed, that bulging and dooming and everything can start as well. Right?
Yeah, on point of view lifting, everyone is totally different, but you need to be healed. You cannot be if you are not healed, you cannot be lifting heavy weights. The progression of lifting could be 1 kilo, could be 5 kilos, could be only the softball, the resistance, depends on how it is the healing process. But we can start from 0 to be lifting so heavy. It is impossible, because if not, we're gonna create an injury, and this is not the goal. The goal is to be healing the process and recovery the function of the deep core muscles as a core function, and later we lift. Depends of the background, but it's a progress.
Right. And everyone's healing, like the healing part that she's saying is going to be very different for each person, because depending on how everyone's healing. And I would add to that part of your healing should be not just like the physical part, but working with your breathing and then nourishing yourself. So please, lots of healing foods, right? Not junk foods. She also mentioned that. So lots of healing foods to help nurture your body, and mental healing as well. I mean, it could have been a trauma that you've been through. So debriefing that, taking therapy for that, all of that comes in as a part of the package as well. I think you've shared excellent tips. So in terms of, because we are coming towards the end, and I want to take questions from the people here as well. So ladies, have your questions ready. I'm going to tell you where you can send them. If you could give 3 must-do tips for every mother, whether she's had a C-section or newly postpartum, what would be some takeaway points that you have to share from your experience?
The first one, healing time. The healing time you need to be doing properly. Don't forget about this. What previous we were speaking about, this is going to be the heal time. Don't rush. Don't be in a rush, because the woman, as a woman, everyone wants to look great, bounce back, be perfect. No, this is time of healing, and you need to respect. Maybe it could be longer, could be shorter, but it's the time of healing. Because if you wanna be in a rush, you can have a issue. This is the number 1. Number 2, reconnect with your deep core muscles. Even if, for example, you give birth with the C-section and you feel your stomach is totally flat and you see yourself great. No, you need to reconnect the deep core muscle, breathing exercises, and do the progression, different kind of exercises to rebuild, to strengthening them. Because in the end, pregnancy is a process. It's a process of change, physiological, structural, hormones. So this expansion coming back is affecting, even if you are a young when you get pregnant, or even if, for example, you are in the 35, 40 years. That doesn't matter. You need to rebuild, as this is going to prevent to have any dysfunction, to have any issue later on it. So this is the number 2. And the number 3 is very important, and this is the people I'm more happier that the people start to be doing, is ask for support, ask for help. Help could be as me as a strengthening coach on the pregnancy and postpartum file to rebuild the strength, or on point of like a breastfeeding, because in your case, like it's going to help to the women to in that point, or if they have an issue with sleep, the newborn doesn't sleep, take help for see how it's going to be, or nutrition. Like you need to find the help, or in your family to support mentally, or whatever is you feel like you don't have the support, ask for help and go for it, because this in the short term is going to give you so much benefits that in you keep going in the long term you're going to feel so overwhelmed. And postpartum stage is a moment that to encourage yourself, to pump yourself, because you've been a process that is pregnancy, that the hormones go over all the place, and in postpartum stage, the hormones go always out of the stage also. So you need to have the support in this moment, because this is going to help you to be faster in your recovery and smoother.
Very important. And I love, especially the last part you said, ask for help. Please don't suffer in silence. If anything doesn't feel right, don't be silent about it, because that is what builds up and then it bursts later, right? So please, 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 any sort of help you feel you need, always know that you should, like, in fact, when I teach my classes, I make sure the mothers write down a little boxes, a list of where they can seek help for lactation, for mental health, for older children care. Like, you should have contacts and people ready that you could reach out to. And it could be simple things like Virginia said. It could be simple things like taking care of your older kids, or making sure that you've got cooked food, your nourishment, your mental health, so many things. So please, mamas, for me, because I know how it is in the society. Once the baby's here, all the attention goes to the baby. For me, you as a mother is important. So please don't suffer in silence. Now, if anyone has questions, we are opening to questions now. You can type the questions. So if you're on your laptop, you'll see the public chat in front of you. If you're on your phone, they're on the top left. There's a little person, you can tap there and find the public chat there, right? So you can just pop in there and start leaving your questions, which we have, like, I can say 5-10 minutes where Virginia can, inshallah, answer any queries you have, or I can answer any queries you might have. And please type them. We are not going to be taking unmuting questions. So if you can just pop in and type your queries. I see a couple of you are typing. So the public chat is on the top left. If you're on your phone, there's a little person, you tap there and you can type your question there. You can type in English, Arabic, Urdu. I'll be happy to translate. And if you're on your laptop, the public chat should be in front of you. Okay, so please drop your questions there. So Stephanie has a question. Is there any specific tip or adjustment to do after a C-section or vaginal birth or belly birth, like she likes to call it, for twins, since the belly is bigger and the internal wounds are bigger? So what would you recommend for a twins mama?
For twins mamas, what I'm gonna recommend, even like a regular mama. First of all, clearance from the physiotherapist. They need to check how's the function of the core, or the diastasis, or the pelvic floor, how's the function of everything. And then we're gonna start to do the deep core muscles. Like, it's true that the twin mamas, like in the end, it's double what is happening. Like the expansion of the deep core muscle is more. So sometimes, like the deep core muscles is affecting more. So we need to do rehab, and maybe it's going to take longer. But diaphragmatic breathing is going to help you to restore all the core function. On point of the scar is going to be the same. The only problem is like the expansion is going to be more. So maybe it's going to take more time. And also, it's my experience. I have many twins mama, if previously they've been training during pregnancy, the deep core muscles, they are not strong, is suffering a bit more, and we need to rebuild the strength in the deep core muscles with the diaphragmatic breathing, and slowly loading with the previous exercises, what I was saying, the glute bridge, bird dog, but with the deep core muscles, the diaphragmatic breathing. This is very important, and be patient. be patient, but we need to see what is the starting point, like the dysfunction of diastasis, no diastasis, because sometimes the twins mama, the expansion of the uterus takes longer to come back, the belly needs longer to come back. So this process is time to be healing, but we need to start for the main point to know exactly what's happening with your deep core muscles. But breathing exercises is going to be helping you so much. Like the deep core muscle and rebuild the strength is the main thing. Is the main thing to be doing. But twins mama, this is my experience, takes a bit longer if also previously you didn't be training.
Very, very important. Thank you so much. Yes, exactly. With twins, I think it's because it's just extra stretched. So there's a lot more she needs to do in first working with the internal and then with the extra skin and everything that would come afterwards. Right. Okay. There is a mother. She's saying, I am 12 days postpartum. I had a C-section. Is there a possibility I can discuss my case one-on-one? What's the procedure for that? I'm going to I'm going to send Virginia's Instagram, if that's okay, where you can get in touch with her. And if she is, and then you can do it. So I'm just going to type that in the chat so you guys can follow her and reach out to her. Do you do online consultations, Virginia?
Yes, I do.
Okay,
to
perfect.
see the cases and see how we can help on that point, or maybe if in that point we need to, first of all, the physiotherapist, we need to see.
Okay, perfect. So I've dropped her Instagram on there. Okay, as we discussed about no postpartum belt and C-section, is it okay to wear after normal birth? Because in our culture, we wrap with clothes after birth. It's after every birth. You're not, because remember, your uterus is healing. It's expanded. When you wrap it, right, or when you wear a belt, you're squeezing a uterus which still needs time to go down. And that is applying pressure onto the pelvic floor. So from my knowledge, at least, and Virginia can confirm, regardless of whether it's a C-section or a natural birth, wrapping or wearing a corset or belt is going to be more harmful than good on your pelvic floor, at least. What do you want to say about that, Virginia?
Totally. This is imagine, like for example, I want to stand so you want to see. This is our core, okay? Imagine like in the pregnancy, this is going to be expanding. Expanding, this is the belly. Then you give birth and come back. And still they are not closed. If you want to put a something wrapping, you are squeezing it. You are squeezing the core. Here is our diaphragm. Here is our pelvic floor. If you want to be squeezing, you want to be putting pressure going down. When I'm speaking about pressure going down, this is meaning like you are squeezing it, maybe the organs going down, or putting pressure, or squeezing the uterus. You don't know how's the process of healing. Healing, we are speaking like if this is your uterus, for example, this is the uterus. The uterus during pregnancy, they expand, they grow. So then it's letting the baby to grow inside. Then in the time of healing, this uterus that it was so big needs to come back. If you want to be squeezing it, you are squeezing it down, up. You are putting pressure to the pelvic floor. That is a muscle that is holding all the pressure is here. If you want to put pressure, can be putting dysfunction, the bladder can go down from the cervix or another organs. No, so keep it, rebuild, like a strengthening from all these exercises that were mentioned before, that this is the way. If you squeeze, you want to put pressure down and provoke sometimes dysfunction or cause another things, because the pelvic floor is affected as well for the hormones. The hormone like the relaxin that all women we have, and is make the muscle to let the hips to expand in the pregnancy. This hormone is make the muscle expand, deactivate, so make the muscles and the ligaments looser. Also it's affecting pelvic floor, also affect everything. So don't squeeze anything, because this pressure, you want to let them to go down. And no, this could be later on to do a surgery for many, but yes, prolapses.
Thank you so much, and I love that you demonstrated it as well. That would make, I think I've seen a video on your Instagram as well, or a demonstration you did on exactly on this. So check out her Instagram. She has explained this very well, why we should not be doing this. All right. Fatma says, it was a wonderful session and I'm a mom to be. Everything became clear to me because she's planning ahead. So well done on you that you're here and you're planning ahead. Mostly what happens in our Pakistani culture after delivery, whether it's a vaginal or C-section, is that we look for a person to do abdominal massage. Oh, wow. Okay, I think I'm aware of that. The idea is to push back the abdomen with oil so that the uterus can return to its normal space position. Also, this practice that we are following of hiring non-professional postnasal massages, is this a good practice or no? No, I would say massages after birth are lovely, like, like bone closing and helping you relax. But no one should be touching your stomach, your abdomen, massaging and returning the uterus back. I'm sorry. Uterus is not something you can squeeze back, right? It took 9 months for it to get there, right? And then massaging and pushing it back. Imagine the pressure you're applying to your, I would say, your core muscles, your pelvic floor. I wouldn't want to even think about the kind of damage it can do. It sounds scary, honestly.
Totally. Everything has a process. Only what is an example that I put for everyone, because the postpartum, we think like we don't see anything. We don't know. Okay, we can see the belly more swollen, less swollen. But think, for example, if someone has a surgery here in the chest, surgery in the shoulder, surgery in any part of your body. When they have this surgery, you want to be putting pressure? No, because it needs to be healing. And needs to be healing the scar or whatever, or heart attack. You want to put pressure after a surgery if they put things inside? No. So this is the same, girls. We need to let the body heal. It's a time, it's a process, and we totally understand, because women will have the hormones, and women play a huge role, like mentally, like I want to recover fast, or I want to do this because my mom or this person told me. Okay, this is your family, but you need to be requesting for the true information that is coming from professional. There are many myths that is coming from before. They were doing this. This is not safe. For example, this kind of massage, like to get bounce back the uterus. No, we need to give the time of heal. Or is something like a constipation that sometimes happens because during the postpartum stage, how's going things. The physiotherapist, when you're gonna go in that, is gonna maybe view some release, but this is after maybe 4, 5, 6 weeks of postpartum, not in the week, for example, 1 or 2, but is the professional who is gonna be telling you this. No, like a recommendation for this person. No, go for the help to ask who is the professional who's gonna guide you in this point. No random, because can damage more. And this time, what we give you, like from the 0 to 6 weeks, 0 to 4 weeks, depends of how the person of the background, respect. Or if you feel like everything is going fine, even go. This is something I say, like you feel as a person, as a woman, because you have this feeling. If you want to go to check with a physiotherapist or another doctor, go and do a main follow-up. But this person is give you the clearance to do or to don't do, but don't do because you think or they tell you, because you can create a big damage, and to fix a damage is worse than to be preventing things.
Exactly. I agree 100%. So yes, it's lovely to be resting and getting some relaxing massages. Please don't go for anything like that. And the fact, Fatima, you are expecting, I just want to, and any other moms who are pregnant right now, I just want to tell you guys about my childbirth preparation classes. The next group is starting tomorrow. It's in English. And then in May, I'm going to have the Urdu group. And then I think June would be the next English one. So we cover everything that a mother needs to know for birth, right? So nutrition, exercise, pain management, how to make informed decisions, doctor shopping, birthing positions, laboring positions, what's happening in labor, how your partner can support you. I teach couples, so your husbands are more than welcome. And how to make your labor easier, what are true complications, early postpartum, breastfeeding. All of these parts, things are very important. And with just mentioning breastfeeding, I just want to add that when you're nursing, we're releasing the same hormone that helps the uterus to contract. So the more you're nursing, it's gradually going to help your uterus go back to its original shape. So making sure you're well informed about breastfeeding and you are definitely nursing your baby after birth will help with your recovery also. And yeah, please don't do anything drastic to yourself, especially newly postpartum, because it took you 9 months to get there. Give yourself the slack and do that gradual recovery that Virginia talked about today, instead of jumping in, and especially from non-professionals. It needs to be somebody who's following evidence-based recommendations. All right. Okay, Miriam's asking, is it safe to use a baby wrap, like the baby carrier? So I just want to add to that make sure you're using an ergonomic one, the one that does not apply. Like, it's, first of all, it's, you're carrying the baby right. It's not a crotch dangler. Secondly, it is not causing you any sort of discomfort and pain. The right ergonomic carrier or wrap, or the wrapping method, would ensure that your back is supported. But after a C-section, usually it's fine, because what we say, and Virginia can confirm this, is that don't carry anything heavier than your baby. So the only weight you can actually carry is your child. So if you're wrapping the baby or carrying in your arms, just make sure, again, your posture and the wrap you're using is correct. What is your take on this?
Totally. What I want to say that there are many kind of wrap, but you need to go for the ergonomic, because this is going to help you for the posture. Because don't use or don't create. I saw many moms also grabbing in position that no is safe. No is safe. I'm not going to be speaking about the C-section, Scar. It's not even safe for the posture, because this posture is going to be killing your lower back and your upper back, like it's the spine, the position of the spine. What we need to be is totally in a line. If this kind of position you are not good, what is going to happen? Like this, you're going to be totally in the position like a crunch, and you're going to be putting any one time more pressure in the pelvic floor. Even the baby is heavier, even if it's lighter. What we need to keep is in a good posture. That's why you need to be checking this kind of grass is ergonomic and keep you the health of your back, because this is, you want to make sure that the deep core muscles, even like when you want to be standing, want to have a properly posture, and it's going to be activate. This is the main thing, to keep your core activate during when you want to be standing, like that.
Yeah, thank you so much. Very important. Charissa is asking, should we see a pelvic floor therapist first or a physiotherapist for diastasis? I would say, and Virginia can confirm, it's the same specialist. They should be able to assess your diastasis and your pelvic floor. So get both checked since you're going. So
yeah, the the physiotherapist, when you are going to the physiotherapist, look, what you need to make sure that they are specialized in women's health. So when they are specialized in women's health, they do the assessment for the diastasis recti. How it is, they're going to use a sonar. You're going to be laying down in a bed, and they want to check the diastasis, how's the muscle, how's the core function, and as well they're going to do internal assessment to see how's the contraction of the pelvic floor. If it's more, if it's less, if these numbers that the physiotherapist is going to give you is going to give how's the contraction of the pelvic floor, if it's weak or is strong. There are women with very weak, there are another one on point, and there are other ones because the trauma of the birth, the pelvic floor get also more contract, more tight. So not only about the weakness, if not, sometimes it's totally opposite. But this is a physiotherapist specialist in women's health, pregnancy postpartum, that is gonna give you all the report, and then they give you a report. So the rest of the professionals, we can continue working in the properly path. Even there are women that only check manual. For me, as my recommendation with the sonar, that is gonna give you all the numbers, everything, and as a professional, you wanna get in very good path to continue working with that.
very important. Miriam is saying thank you for the session, and she's saying, when is it safe to return to intimacy after a C-section, and what are the signs of diastasis, and how do we get checked? So that she just answered, that you get checked, and you would see some dooming happening in your stomach as you're getting up. In terms of intimacy, it is usually once basically your bleeding stops, because that's a sign that your womb inside, the wound inside your womb is healing. I would say give yourself the first 6 weeks, definitely. After that, see how you feel, right? Whether you're ready or not. But two indications: 6 weeks and your postpartum bleeding, right? These are the normal things I would say, and when you feel mentally and physically ready, honestly.
Totally. And also I want to say, like, for example, what were the checkups and see the pelvic floor. Also, in this kind, when you want to be ready, and this is great. But if you not feel in the internal, okay, pain, you need to check, because sometimes even like the pelvic floor and the cervix get very tight, and you not feel very, very with so much pain. many girls think like it's something wrong. No, it's about something wrong. It's like the reaction of the muscles after the surgery, that is a C-section, or anyone, even in the case of vaginal birth, get very tight, and we need to see how it's gonna be going things. And this is a physio when they do the internal checkup, they wanna be saying and see if there are any issue, or only it's like stagnance from the pelvic floor or the cervix, but this needs to be checked. Don't put a mind if something is going bad, something wrong. No, it's like you need to check, and this is gonna give all the feedback to see for good, for release, to strengthening, but we need to know what's going on, because the body after birth or during the pregnancy is getting a shock, is getting like many changes happen. So after needs to get adjust for what it was previous pregnancy, but this a time for healing, even in this case, or for anything basically, or physically or mentally, for everything, but focus and check and to see how it's gonna be going things in your body.
The scar massage. So basically, if this is your scar, Virginia said massaging around it, and then gentle pulling. And what did you say more? What's needed for?
If this is imagine the scar. I want to say, imagine this is my scar, right? Let me see. Wait a minute. I want to be holding. This is the scar. Wanna be with 2 fingers. This is always I give the recommendation to all my girls. You finish the shower, you go to the shower, take shower, you go out, you dry yourself, you put lotion to your face, everywhere. So what you wanna do with any lotion in the beginning, like circles on top of the scar, okay? No pressure like putting pressure, no, like normal, like you feel comfortable, okay? Circles to one side, then to the other side. When you finish from the side, like imagine the scar, you wanna be extending, okay? From up to down, extending. This is the scar, like that, to extending up and down, okay? And then imagine this is the scar, you wanna take the skin from the scar and like pinching a bit and remove the skin from the scar. Because the main goal is to pass the blood circulation, all the oxygen. So if it's the skin, the fascia, the muscle, they are together, slowly separate. This doesn't happen in one day. You need to be consistently. Same, an example, what I put for you. Same when your newborn is here with you and you care about the feeding, about putting food, about all these things. You need to take care about yourself. So every day you take shower, every day you do that, like the massage. It take you 5 minutes, 10 minutes, not take you more than that. Or if you feel any like a tension from the lower back, put your baby in the place close to you. You don't need to a mat or outfit or anything. Do some cat-cow tilts position to decrease this kind of tension on your carpet in the living room or in the carpet in your room. It takes you 5-10 minutes. This every day, these gentle movements in the beginning is gonna give you a green light for later on it, and slowly to rebuild and to help you so much. Very important, because this is all these steps what I mentioned to you. I saw girls doing and not doing. How's the recovery after 6 weeks, for example, when we can start to be doing more things.
Very, very helpful. Thank you so much. Yes. And I think this is the reminder we all need again and again and again, all the time. You are very welcome. Everyone is loving it. So last question, is it normal to feel pain around the scar 6 months postpartum? Yes, there can be some, because remember, it's not just physical pain, it could be psychological pain as well. That our body is holding that trauma. That's the first thing. Second thing, it can still be a bit tender, but if it is very painful and it's a stabbing, sharp pain, I would get checked.
Totally, like what is going to happen, what we mentioned. Some women have this 6 months paining around the scar or around the belly or numbness, and this is happening because adherence. So this needs to be checked. This is not normal. Like what do we say? In the first 6 weeks postpartum or after the week 6 to 12, we need to continue doing this rehab for the rebuild to feel much better. But if 6 months if you do previously, you need to continue doing. If you don't do, you have to start. If you have this pain, you need to be checked. because to see if adherence or coming from prolapsum or like your core needs activate the core of the function, what we're speaking this area like is off, like the core function needs to be activated, needs to be holding. So the scar doesn't give or doesn't have the support because having so much pressure. No, we need to rebuild as a core. We need to release if something needs to be released. We need to strengthen something to be strengthened. We need to check. We need to see what's going on. And the treatment, as a treatment, like a rehab, no rehab, strength, training, we need to see what we want to be doing. But this needs to be previously checked. If you don't do anything before, you need to start. If you didn't be checked before, you need to check. But this is not only about the clearance from the doctor when you leave the hospital, it's like a physiotherapist and then our profile, like to be rebuilding and to be fixed, and it's gonna be helping you so much in that point.
Very important. Very, very true. So, yep, that brings us to the end of our question and answers. I just want to thank you very, very much, Virginia, for taking out the time today and helping spread this awareness. And I want to talk to every single C-section mother sitting with me. I'm one of you, like I said, that I just want you guys to give yourself a big hug. And I want you to understand that you are amazing. Each one of you is amazing. And it is not ever the easy way out. And recovering from a C-section mentally, physically, emotionally is never easy. So please never hesitate to reach out. And inshallah, if you want to plan for a natural birth or a VBAC birth, these are my birth prep classes. Please feel free to reach out to me. And I have shared Virginia's details, and I'm going to put it in because this is recorded, I'm going to upload it onto my YouTube. I'm going to put in Virginia's account details there as well, her Instagram, so if you guys want to reach out to her as well. And I also offer specialized workshops in newborn care, pumping, increasing milk supply, starting solids, toilet training, weaning from breast milk, baby-led weaning, breastfeeding. All of these specialized workshops are there alongside my birth preparation classes. I do online consultations as well if anyone needs. And like I said, VBAC, vaginal birth after a C-section, is my passion, the reason I'm here today, subhanAllah, alhamdulillah. All right, so yes, again, a very, very warm thank you to Virginia for being my guest for this episode number 15. It was such a pleasure to have you. And I hope you all benefited from this session. And I hope to see you in future episodes as well. I already have 2-3 topics lined up, inshallah. And so thank you very much, Virginia, for being with us today.
Thank you to you to have me today and to spread more awareness. We are hoping to help to everyone, to open their minds, to change many things that we need to be changed, mentality, because from before the people thinks that we cannot train or we cannot be moving or we cannot do a C-section, we cannot do anything C-section after 6 months, and it's totally wrong. We need to change these points and give all the awareness that is going to be helping to everyone and continue doing the things properly.
Inshallah, definitely. All right, thanks to you, and and thanks to Amani Birth for these amazing awareness birth classes that I teach are from Amani Birth. It's the Blessed Start course. You can check them out as well. They have amazing content for you guys to cover. I am also trained from Amani Birth, and those are the birth classes I teach. And like I said, my next group starts tomorrow. So if anyone wants to hop on, please message me. I have, I think, 1 or 2 seats left. I'm happy to accommodate more, inshallah. All right. Until then, please take care of yourself and stay safe. Be easy on yourself. You are doing a great job, Mama. Being a mother itself is not easy. And on top of it, trying to take care and keep these little humans, taking care of them. I'm sure we all appreciate each other. So hang in there, surround yourself with support, never suffer in silence. That is my key takeaway from today. And thank you everybody who joined us. Jazakumullahu khairan. Assalamu alaikum wa rahmatullahi wa barakatuh. Take care.